Hello, everyone. I'm Dr. Jim Hoven at FitMD, and I have with me the clinic director, the one and only, the world famous, or at least Arvada famous, Donielle Montoya. She's the person that really helps FitMD go. She is involved in every aspect of our business, making sure that she's interfacing with clients and with our team members and with us as providers, all of us working together. So I am so glad to have her here talk with me today and talk with you about FitMD, because one of the things that we always hear is, why should I go to a clinic? Why shouldn't I just do the things that we do, especially when it comes to hormone replacement therapy, medical weight loss, GLP-1, GIP stuff, all that stuff? Why should I go to a clinic? It seems like it's more expensive.
I can do it online.
I can do it online. So we thought it would be good for us to just share with you for a few minutes the advantages of going into a clinic for supervised care, and specifically what sets us apart from our competition at FitMD. So Donielle, why don't you give a virtual tour, if you will, of what we are about at FitMD, on who we are, what we do, and we're really happy with the results that we get.
So FitMD in general, a lot of people don't know what we do. The two kind of main areas is hormone replacement therapy and medical weight loss. Now, we also do stuff like IV therapy and body contouring. We have some cosmetic services, things like that. So that's kind of our practice as a whole. But what's neat about what we do, especially when it comes to the hormone replacement therapy and the medical weight loss, is we can pair them together. So often people will come into me and say, I have done everything to lose weight, but I just can't lose weight. The first question on my mouth is going to be, have you looked at your hormones, right? Because hormones don't necessarily cause you to lose weight. As soon as you start hormone therapy, the weight's going to drop off. But if you're starting a weight loss plan, or you're doing any type of weight loss stuff, and your hormones are completely out of whack, then that weight loss plan may not work.
Get sabotaged.
Right.
Yeah.
And it's setting you up for failure, but you're doing everything right.
Mm-hmm.
You know, a thyroid, for example, your thyroid numbers are such an important number, because it might be when your physician office looks at the labs that, you know, you're from here to here, you're normal. But for weight loss, we kind of want you here, right? Or for your testosterone levels, you might be good from 200 to 1100. And so at 200, you're within normal range.
You
and
think
someone
you're
might
normal.
they might dismiss you because you're like, yeah, you're within normal range. But do you think you feel the same at 200 as you do at 1100?
Right.
No, our goal is that live optimized, is how do we get your labs optimized? How do we get everything optimized for you?
From my perspective as part of the provider team, is one of the things that makes us really different is not only the fact that we do blood work and that we go through that with our patients, but the blood work that we do. So if someone comes into us for hormone replacement therapy, or they want to get their thyroid specific checked, or they say, hey, I'm on a weight loss program and my hormones might be part of it. Can you check that? Can we combine it, like you were just saying? I've heard advertisements on the radio where come in and get your blood drawn for $99. And if you start on the program, that blood work is free. Well, the big print giveth, the little print taketh away, right?
Right, exactly.
What people don't tell you is on those kind of blood panels, they're very small, they're very limited, where they're looking at a total testosterone on a guy and a gal, and if they do ladies, and they're also looking at PSA and not much else.
Nope.
Right? And so for us, we just think that's a disservice for the big reason on just the testosterone component. I'll get to the rest of it in a minute, but on the testosterone component, if we just look at your total number, as Donielle referred to, that range is huge. It can be from anywhere, depending on the lab range that you use, it can be from 300 to 1100. And so, for example, I'll use myself for an example. When I first checked into treatment now years ago, my total testosterone was like 847.
Right.
That's high on the scale, especially for my age at the time. But that's not telling the story.
Nope.
The story is told in what's called our free testosterone, and the free testosterone is that which is bioavailable. So imagine if I go to a clinic, if I would have gone to a clinic, they said, man, your testosterone's at 847. They'd have said, you're golden.
And you
don't
don't
worry
need
about it. You don't need treatment. But when we looked at my free, it was at 6.7. Now, that's low. It's literally, it should be up at that time where my age was, it should be 24.
Right.
So I was almost a fourth of what I should be, 25, 30%. Right. And the difference that it made in me.
Especially if you're symptomatic.
Yes.
So you're like, I'm feeling all of these things.
Yes.
But so how can you tell me I'm normal? I mean, I'm sure no one's ever gone to the doctors and be like, I feel all this, but it's in your head.
It's in your head. It's
right.
Stress. It's in your head, right? And so that's one thing that I'm so proud of the way that we do things, is Dr. Ramos has set this up. It's to do it the right way. So we look at a complete blood panel. I mean, you're looking at CBC, lipid profiles. So we're looking at how the system all the body systems are functioning. We're looking at the kidney, liver. We're looking at cardiac with our lipid profile. We're looking at all the general panel stuff to see how is your immune system functioning, because it all works together so that if HRT is not the right thing, we can spot that. And we've sent people out that end up having cancer, and we caught it on a screen. I'm so proud of that. That's one thing that
Especially
really
diabetes is a
differentiates
big
us.
one.
And diabetes as well.
You know, really looking at the hemoglobin A1C, seeing what that 3-month snapshot of your blood glucose levels look like. And it's interesting because when I talk to a lot of people, they'll say, oh, I just did a full panel at my regular primary care office. That's great, but a full panel and a full panel are not the same thing.
Yes.
So a full panel in a family practice office might be one thing. A full panel in a OBGYN office might be another thing. Everybody's full panel is different. Our full panel is very focused on hormone health.
And
which
what
is
about
really
weight
important.
loss? How are we different in a medical weight loss setting compared to so many, whether they be in-office clinics or the shops where you just order online and, you know, they might come from another state or, God forbid, another country? How do we differ from that, from your perspective?
Well, I think a few different things. I mean, we have different options. We have the GLP-1s. We have, you know, different medications that a lot of offices have. But we also have coaching and accountability, which is really important. We also have programs that are more specifically designed to what those people's needs are. So it's not the same for everyone.
Yeah, and I think sometimes the best medicine is no medicine. And what I mean by that is I have heard stories of you meeting with patients who have come in desperate to get on a GLP-1 program, right? They heard from their friends, they saw it online, they heard on TV, whatever. And after a really thorough history with you and our medical weight loss team, we found out that they had thyroid cancer in their family. We found out that they have macular issues. There's certain things, you guys.
History of pancreatitis, history of blockages.
Right. So there's certain things that you guys need to know family history-wise. They preclude you from getting some of these medications, these advanced medications, semaglutide, tirzepatide, Ozempic, Wegovy, whatever you want to call them. They're not for everybody. And so this is where danger can happen. And we really make it a conscious effort to practice a different way. One of our core values is we're the best in class at what we do. And to me, what we've set up here and what you really are vanguarding is making sure that on the medical weight loss side, people are right for the program. They're getting the right medication, the right dosage, the right timing, and the support. And if it's not one of the medications, we have so many other options.
And the history of what they've done in the past, right? So they've done things in the past that haven't worked. Why didn't it work? And let's not, what is that definition of insanity?
Yeah, repeating the past,
repeating the past. So let's do something different. Let's figure out, or did that work, but it was your hormone? Like, it's just really understanding the kind of weight loss side of things.
Right. And we have
and the science behind it.
The science behind it is key. And that's where Dr. Ramos is so great, because he's always scouring the research, looking at things, making sure that our protocols are really dialed in. We have a couple other facets of the business that I'm super proud of, one being the IV and the peptides, right? And they're not really the same. I mean, some of them can kind of cross over, but explain a little bit about our IVs and how we use those. I mean, you're involved with a state championship POMS team, and it was so cool to see basically a good majority of that team, state championship team, going to compete for nationals, coming to get an IV to help them perform at their best.
Yeah, so we offer an IV. It's an immunity IV that has a big bolus of zinc, well, tons of vitamins, minerals, things like that, but it has zinc and vitamin C, things like that in it. So as you were saying, we had our national dance team. Just so you know, I'm not the dancer, it's my daughter. But my daughter and her team were competing nationally down in Florida, and you know, a couple days before, hard practices, everything they're doing, they come in, they get good vitamins and minerals and hydration and all that to really prevent them from getting sick and really worn down. So we have the immunity IVs. We have just a Myers cocktail that we call Quench.
The big
one. Those are the big ones of just like, hey, I'm dehydrated. People can get these weekly. We're so bad at getting our water in and doing those things. It really helps you be able to keep your body hydrated and good vitamins and minerals, especially when you're in a weight loss program, right? So often people will come to me and say, I'm losing my hair, right? GLP-1 caused me to lose my hair. Well, a lot of times it's the vitamins and minerals that you're lacking when doing weight loss. So rejuvenating those with these IVs can be really helpful. We have another one that's it's called a Get Up and Go. And this one is really focused on boosting your metabolism. We have a great IV. It's a recovery and performance. My 100-miler bike rides or my triathlon people, they'll come in after they train and getting that recovery and performance to really help enhance their muscle recovery, things like that.
And you know, it's really cool. We talked about not only that, but this peptides, right? Everyone's heard about peptides. A lot of people don't know what they are. They're simple proteins combined together in different lengths of chains that do different things. There's over 10,000 of them in the body. So there's tons of them that do things naturally. And now we're harnessing that, right? Science is beautiful.
Right.
And we're harnessing that. And we have really, really dove into the peptides. We were just at a meeting about it this morning.
Yeah. Always trying to
Peptides
find
and
the
what
best
they
way to do it.
Yep. How can we combine them with the other things that people do outside of the office, the services we have? And I'm really excited because we're talking about NAD plus today and using that as part of the energy system and helping build energy and clear.
What was that quote Dr. Ramos said today? 50%.
Yeah. By 50, we lose 50% of our ability to produce NAD plus, which means that we have 50% less ability to clear free radicals from our cells, which is a horrible process. We need to clear those, and to build ATP up. So if we supplement that or reproduce that back in our body exogenously through NAD plus, which we do in our clinic, then it helps, especially after 50, helps those repair processes. So that's a big thing. And the other proteins that we have and that we're looking at bringing in affect everything from how tissue and skin repairs if you've been injured, how we have things even like skin and anti-aging, right? Yeah, I'm going to jump on some of that. And so it's just a super exciting time. That makes us different. And then the final thing that I can think of that I'm really proud of that we've seen is our body contouring and even are using our M-Sculpt to help people with chronic pain.
Yeah.
Like that has been a really cool thing.
Yeah, that's been really neat.
So explain what you're seeing on the M-Sculpt side and how it combines with weight loss. And then like tell that story of our patient who had the shoulder thing and after doing it, just amazing results.
So the M-Sculpt Neo that we have in our office, it is originally designed as a body contouring machine. So our goal is to lose fat, build muscle. So for all the people who are losing muscle on GLP-1s, we have the ability to help build some of that muscle back. But ideally, it's for spot reduction in areas by using a 2-frequency method, an RF frequency and a high FEM frequency. That RF frequency is going to help heat up the fat, create lipolysis, and do fat destruction up to 30% in an area. And at that same time, when you're treating it, you're going to build up to 25% muscle growth with that high FEM frequency, the super contractions and things like that. So then what happened is M-Sculpt came out and said, wait a minute, we have this whole other functionality, which is a functional medicine side. And so what it allows us to do is it actually helps us with things like back pain, shoulder pain, knee pain, post-surgery recovery. We're doing things like plantar fasciitis, like all these crazy things that we can do now. And it's using the different sensors on the machine. As you were saying, we had a gentleman that came in and couldn't get his arm kind of more than 6 or 7 inches off of his ground or off his arm. We were able to treat the shoulder area and he could do full range of motion after 4 treatments.
It was amazing.
So it's pretty cool and avoided surgery.
So good.
So
as we talk about this, it gets me more and more excited about what we do because we're in it every day, right? We're doing the thing. But as we look at the totality, the umbrella of services, it's just a real treat to work here. It's great to see these patients get results in all these different ways. I just really appreciate the chance to work with you in this and to work with Dr. Ramos and the rest of our amazing team. If I could tell people one thing, it's when you're looking for any of these types of services, make sure that you have a good connection with the team. Make sure that you find out, is the place comfortable? Do you feel taken care of? Because online stuff, while it may seem convenient, and while it may seem more affordable or cheaper, I would say, that's not always the best experience. Right. And it's not always the best outcome. So for us, safest. Yeah, thank you. For me, it's the experience, it's the safety, it's the professionalism, it's the knowledge, it's the always learning that really sets FitMD apart. And I thank you for being a part of that.
Thank you. You too.
So if you have a question, please reach out to us. You can reach out to us, fitmdusa.com. She's Donielle at fitmdusa.com. And I'm Dr. Jim, Jim, at fitmdusa.com. Let us know how we can serve you, help you, and we'd love to see you in the clinic.